we're being joined this time by Dr. Richard Epstein. He's a has a dental practice in Westport.
Hey,
Welcome.
Richard, welcome to the show. First time.
Thank you very much. Yes.
But I understand that now I'm intimidated. You're a radio personality.
Yes,
you really
exactly.
know what you're doing.
You
don't know what
there.
we're doing here. Shouldn't tell the viewers that, let them in on the secret. Anyway, I mentioned to you before the show, my dad is was a dentist, practiced up until, I don't know, the mid-1970s, and his dentistry is very different than dentistry today. There have been some major changes.
Very different.
Tell us some of those.
Well, I think the 70s was sort of a crucial turning point. Since then, technology's really crept into the profession. For instance, in diagnosis, we now use digital x-rays, some forms of CAT scans, particularly for implant dentists. We use photographs a lot. In my practice, when a new patient comes in, not only do we take a whole set of x-rays, but I take an entire set of photographs of them and put it up on a TV screen. And it's amazing. People just don't know what their teeth really look like. They're used to seeing themselves in the mirror, just, you know, these front teeth, and they never know what's back there. So it makes it much easier for me. You know, I used to describe to someone, oh, you've got a big filling in the back tooth. Now I just blow the tooth up, I put it on the screen, and they look at it and they say, oh my, you know, that's me.
Better fix that.
And, you know, it's good. Rob was talking about educating people.
I was just going to ask about that. Go ahead.
That is the best way to educate, because they really don't know what we've looked for. You know?
So when you show people some receding, red, friable, fragile gums, you think that helps to make it real for them, that they should floss and care for their teeth?
Absolutely, because, you know, look, teeth and gums, they're very small things. They're hidden away. You know, you as physicians see people with the rest of their body. They can look at their hands, they can look at their stomach, but they really don't know what's inside their mouth. And once you show someone what they look like as a professional sees it, their attitude changes completely. And they ask, okay, what do we do to fix this now?
And in terms of fixing, you know, we talked a little bit before, there really have been so many advances, and one of the reasons we think people don't get to the dentist is they're afraid of pain, but even that has dramatically improved.
Well, there doesn't need to be pain. I mean, anesthesia's been around for 100 years. Why some older dentists sort of never used anesthesia has always mystified me. I just don't get it. You know, I mean, there's no other part of your body you'd let someone cut into without numbing you up first. And so...
There's nothing macho about showing that you can handle pain. I remember some people used to say proudly, you know, I go to the dentist and I don't use anything.
Yeah,
and
but
I'm not thinking, moron, what are you doing?
It's better for the patient, it's better for me. I mean, I can't do a good job if I'm worried that, oh, if I go there, they're going to be jumping. I mean, I want someone to be relaxed.
But the thought of having someone put a needle into your mouth, which is such a sensitive area, I think is frightening. And yet I mentioned to you again before the show that I've been through a lot of dental work the past couple of years, and it really is so extraordinarily comfortable.
It's very invasive because you can't look away. You know, I mean, the first thing I do when I have a patient in the chair is I put sunglasses on them. It cuts down the amount of light they see. You know, I use a headlamp and magnifying glasses as a lot of dentists do now. You've got the bright light up above them, shining in their eyes, so it immediately calms people.
How about music? I know for some dentists we're using music.
Yeah. And well, I'm a musician too, so I change music, and a lot of people bring in their own.
Ask about that.
Yeah, they bring in their iPods. I select music from all over the world. I use iTunes, and some people bring in their own CDs. So that's calming too. I mean, the idea is you should be relaxed, you know. So if you numb someone up so they don't feel what they're experiencing there, I mean, yeah, it's not easy to keep your mouth open for half an hour or something like that, but it's a totally different experience. And especially kids going in today, less and less cavities in kids means less and less drilling, so their experiences, you know, modeling are so much better when they start out. And the parents, a lot of them these days have had good experiences also with a dentist.
Say something about why kids have fewer cavities today than 25 years ago?
Sure. Fluoride's number one. I mean, you know, the consumption of fluoride in the water supply has cut down the amount of cavities. Number two is sealants. Fluorides act on the smooth, hard surfaces of the teeth, the interproximal spaces between the teeth, and the grooves once you seal them up and don't let the bacteria actually bore through them, which fluoride doesn't really help. That eliminates the other big source of
So
cavities.
do all children get sealant today, therapy?
Routine. It's considered the standard of care for all the permanent teeth to be sealed.
Before we leave fluorides, I'm sorry, just the issue of well water. I think we need to discuss that in bottled water.
Well, some well water has natural fluoride in it, and it can be tested. You can send it to the state. I've done that many years, and very little of it in Connecticut really has fluoride. So parents should be aware that there are fluoride supplements if they have well water. Or if you drink city water, you know, you've got to ask, do the kids drink city water, or are they on bottled water, some of which doesn't have the fluoride either.
You should talk to your dentist or pediatrician about how much fluoride your child should take, because you can get toxicity if your child takes in a lot of fluoride.
You know, the toxicity issue is something that's been debated, but really the first sign you'll see is that the permanent teeth will come in with spots on them, mottling. Fluoride was a natural substance that was in wells in Texas many years ago, and generations of adults and kids grew up with no cavities but mottled teeth, spotted teeth, and that's what sort of clued the researchers into saying, what's happening here? There's this whole community, they're not getting cavities, but they have funny looking teeth, and that's what started the research to show that a certain amount of fluoride protects you against cavities. If you over-fluoridate, it's very hard to really. I mean, you have to take such enormous levels of it that you have to really try hard to do that.
Is fluoride in, or fluoridated toothpaste, does that substitute for fluoride treatments or fluoride therapy?
The fluoride you ingest in the water supply gets built up into the teeth. And you know, enamel on the outside of the teeth that's exposed to the environment is very, very dense and hard. It's the hardest substance in the body. But on the outside of that enamel, there's a constant process of erosion from the foods you eat, from the acids. When you drink soda these days, you've got a low pH solution you're bathing the tooth in. And so what you're doing is removing some of the minerals. The fluoride in toothpaste or fluoride in rinses adds that top layer back. And that's why you have to keep doing it. The outside of the tooth is a dynamic process, and they're studying that more and more now. They're finding out that proteins and substances in saliva are interacting all the time with the bacteria that are surrounding the pellicle, as they call it, of the tooth.
Remarkably, we have a little under 2 minutes left. I know you wanted to talk about some of the other advances in dentistry, such as implants, etc.
Absolutely. Well, the standard of care now in replacing a missing tooth is to put an implant in. And that technology essentially came from the orthopedic surgeons, you know, how they affix plates to the body with little titanium screws. It's just a larger form of a screw that replaces the root. And that has an internal screw too, and you put the tooth on top of that. So you don't have to destroy natural teeth to replace a missing tooth on somebody.
We have 30 seconds left. Why do my teeth hurt after I get them whitened? Even the artificial, I've done it with the artificial strips once, and they hurt after that too.
The substance penetrates the tooth. It's basically hydrogen peroxide, and goes towards the center of the tooth where teeth are generally more sensitive. So it's always a side effect of it, but they're now adding desensitizing substances to some of the whitening agents, and you know, I have my patients brush for 2 weeks with a much stronger desensitizer, and it's not a problem anymore.
That's great.
So you can have white teeth and comfortable teeth at the same time.
You should have comfortable teeth always.
Thank you so much for all the information. Clearly we could ask you questions all day.
We just got started.
Great.
Thank you.